Hello and welcome to another exciting episode of You and Your Health, the show that prioritizes your well-being. I am your host, ASP Kafui Ajiman. And as always, we bring you expert insights into important health matters. Don't forget our mantra, let your health be your priority. Today we focus on remarkable transformation happening at the police hospital. This institution has been a cornerstone for law enforcement personnel and the general public. And in recent years and times, it has undergone significant changes to improve service delivery, technology, and patient care. But what exactly has changed? And how do these advancements benefit you and I? And what does the future hold for healthcare at the police hospital? We are live on GH Police TV, DSTV channel 362, and all our social media handles. You can follow us on Ghana Police Hospital on Facebook, on Instagram, and on YouTube. And on Twitter, we have police_hospital. So to help us understand these developments, we are honored to have a special guest of honor in the person of Commissioner of Police, Dr. Samuel Otunyakun. He is the medical director. He's a public health consultant who has worked for many years at the police hospital. He hosts specialties in maternal and child health and as well field epidemiology. His research interest areas are in HIV/AIDS, hypertension and pregnancy, and intimate partner violence among pregnant women. He's a member and a fellow of the Ghana College of Physicians, and as a key figure in this transformation, he has been instrumental in shaping the hospital's new direction and ensuring a better healthcare outcomes for all. Sir, it's a pleasure to have you on GH Police TV, You and Your Health show.
Thank you very much, and I welcome you and your team to this hospital.
So, zooming right into the conversation, we would like to know a brief history of Police Hospital and its core mandate.
So the police hospital was established in 1976. Actually, it was a private hospital somebody had built, and then the Champon government thought it wise to hand it over to the police. So that is how come the police hospital was started. So it started small with very few doctors, very few nurses. Various medical directors have come and gone, and it's now at 10. The police hospital is specifically for police personnel and all their dependents. But we don't just take care of police personnel and their dependents. We've also opened our doors to civilians. So actually, as we speak, 80% of our outpatient attendance is civilian.
Wow.
And 20% is for personnel and their dependents. So we are very much open to the public as well.
So what exactly distinguishes the Ghana Police Hospital from other hospitals in the country?
Yes, the thing is a focus. You know, our primary focus is our personnel and their dependents. Yes, so we make sure that when personnel and their dependents come here, they feel comfortable. You see your colleague, policemen and women attending to you in various specialties. That alone is comfort, because you are in your own area. It's your zone, your comfort zone. Everywhere police officers meet fellow police officers, irrespective of the specialty that they are dealing with, they feel comfortable. So that is what distinguishes us from the other public hospitals, our focus on personnel and their dependents.
I know that you are enveloped by some of our sister security service. Do they also have access to come to the hospital?
Oh yes, in fact we welcome all. So we have immigration officers coming here, fire, we have prisons, yes, customs. We even have military men coming here. Wow. So we don't, select. Once you come here, you are a guest, and we treat you like a king or queen.
Nice. What are the main services provided in the hospital?
So we provide all the major services in medicine. So we have internal medicine, and within that we have nephrology, that is a dialysis department. We have a specialist for that who's a nephrologist. Then we have surgery. Within surgery, we have urology, where we deal with male matters, prostate and all those issues. We have a specialist for that. And then we have orthopedic surgery, where we deal with bones and trauma and all that. And then we have general surgery, where you have normal general surgery. Aside of that, we have pediatricians. In fact, we have 3 or 4 pediatricians now who are taking care of our children. Then we have obstetrics and gynecology, where you have women mainly, delivery, pregnancy, and other health challenges of women, infertility treatment, fibroids, all those things are handled here. Then we have psychiatry, okay, and then we have clinical psychology, which is quite distinct from psychiatry. Then we have public health, where you have several, environmental health is there, disease control is there, HIV care, child welfare clinic, antenatal is all under public health, TB and malaria control under public health. Then you have the laboratory services, where we do a vast range of lab tests, urine, stool, blood, all those things are done. Then we have radiology, where we have all the imaging and others. Then we have medical records, where, when you come, they are the first point of call. Aside of that, we have 24-hour emergency service. So any day, anytime, if there is an emergency, you come, there are dedicated staff to take care of you. And then we have the outpatient service, which runs every day, up to 8 p.m. every day of the week.
Wow.
Yes.
Very interesting. So Dr. Otunyaku, you wear many hats, from a clinician to a public health consultant to a researcher and now the medical director. What has this journey taught you about healthcare in Ghana, or healthcare leadership in Ghana, and then your approach to leading the police hospital now?
So, like you rightly said, I wear many caps, and these varied experiences has really broadened my knowledge when it comes to healthcare management. Okay, public health, there's a special course, health management, in there. And in field epidemiology, there's another course like that. So these varied experiences actually sharpen and broaden your knowledge when it comes to health administration. Being a researcher too gives you a critical eye, okay? So when you see figures, you don't just look at them, but you have the knack of going into details and finding out the nitty-gritties and where you can improve or shape or manage. So being a researcher too, I must say, has shaped my view of how to run the health facility.
It's really insightful. Now let's talk about what's happening in the police hospital. Many people have noticed the changes. Can you paint a picture of what the hospital looked like before the transformation?
I would say that we all know how police hospital was. We've all been here for years, but this turn, we wanted to change the image. Okay, so when you hear of police hospital, what's the first thing that comes to mind? So you see that the appearance matters. If you go to a hospital and a place is not well kept, it's not painted, weeds everywhere and all that, although you may have very good doctors in there, your faith and trust in them will not be that high. So that was the first thing that we set out to do. So this new management set out to make sure that when you enter the police hospital, the ambience is very welcoming, and that will set the tone for the kind of care that you receive. The next thing is, renovations of the various departments in the hospital. So we were very conscious of what we were doing. So as you see, the administration has been renovated. When you go to the records department, renovations have happened there. You go to the various wards, we've done that. You go to the lab, it's been refurbished.
Oh, wow.
So these things actually increase the trust of people that come and see us. Again, I must say that we've taken the welfare of staff very seriously. The kind of chair you sit on, is it a chair that will give you backache when you retire?
Wow.
So we've consciously spent some money to make staff feel comfortable. So we give them ergonomic chairs, ergonomic tables, tables that you don't have to hunch and write. You know, our nurses sit for long periods, doing their work. So we've done a lot of that. The ambient temperature within which you are working. So if you are working in a temperature is, let's say, 39 degrees or 35 degrees, can you work?
Discomfort.
The discomfort alone. It won't allow you to focus on our primary targets, which are our clients, our patients. So we've done that. We've done a lot of changes in the air conditioning system to make sure that people feel comfortable when they come. We've provided fridges, we've provided microwaves, stuff like that. Again, there's a project that one international organization helped us do. That was piping of the oxygen. So now you hardly see oxygen cylinders being rolled up and down. It was really dangerous. If you are in the ward and this cylinder falls on you, falls on your leg, it's very bad. So we've done the piping. So now we have a central place for all the cylinders, and there's manifolding is done. The next thing is, you know, the elimination of the folder, physical folder system. I think that has been transformational. You know, back in the day, you would come here and then it could take hours for you to retrieve your folder.
And sometimes you don't even get them at all.
Yes. So these problems had plagued the hospital. So we took the bold step together with the new management to make sure that we eliminate that system, and that's exactly what we've done. So now you see computers everywhere you go. So nurses are not having to, you know, deal with folders upon folders, and you know, at times some leaves can fly out, you can't find it. So now everywhere is computerized, and it has really increased the joy and the comfort that our clients have when they come. You just go there, your card is made, and that is it. You don't hold any physical thing anymore. So you go to the doctor, your information is there. If you are to go to the chemist or to the pharmacy, to radiology, to public health, family planning, lab, everywhere. You don't carry any folders. And this has really made our patients very, very appreciative of what has gone on so far.
I'm very excited knowing what the old hospital looked like. I have termed my this interview as a new police hospital. Then one will be wondering why the new police hospital. I think it's just basically the transformation has been, it's massive, yes, and everybody can attest to it. One key infrastructure you said was the oxygen plant, but I've also realized that we had a place for senior officers. Now you have been able to give a VVIP POMA waiting room.
Yes.
What inspired it?
Okay, so we realized that, you know, you come, you see retired IGPs, retired commissioners, retired deputy commissioners, all struggling with the others at the officers' waiting room. It was not nice at all. So we created another room. You know, the records department was occupying a lot of big spaces. And this was because they had to stack manual folders. But then when everything is on a PC, you just need a PC. You don't need all those folders. So it's one of those rooms that we have used for the VVIP waiting area. We appreciate the work that our former inspector generals have done, our former commissioners have done, former deputy commissioners have done. And we thought that that was just a humble way of appreciating the good work that they've done for the police service, so that when you come, you have a comfortable space to sit in, to watch television, to have your vitals, everything taken, whilst you are waiting to go and see your specialist. So that is what inspired us to do it, and it's done, and it's there for you to see.
How is the police hospital now positioned to manage both routine and emergency care more efficiently than before?
So the routine care normally is done at the outpatient, and then the reviews that you have with your various specialists. So when you go to the outpatient, you see some development there. It's all to make people comfortable when you go there. At the emergency, we've done some serious changes over there. So when you go there now, you wouldn't see stretchers and patients lie on the floor and all that. We've changed that. But we've done a triaging area where we have 3 stretchers. So when the emergencies come, they don't have to enter. Or they are seen at the triaging area, and then the specialists decide whether we are going to admit them, refer them, or keep them 48 hours or less. These days when you come, you immediately see the change at the emergency. The workers are there. The nurse has a nice triaging table to sit on and computers to work with and all that. So those are the changes that have happened in the emergency ward.
What new medical service or specialized units have been introduced at the hospital as part of the upgrade?
Yes, so I think the first thing we did was to set up a biomedical department. Initially it was just under works. And we realized that no, this is a specialized area where they deal with medical equipment and stuff like that. So we've separated them. So that is a completely different department that we have created. Aside of that, we've created committees that will seek to address, other challenges. We are in a digital age now, and if you want to market yourself, you need to be on the net. So we have a committee that deals with our website development, and we have a website that is up and running 24 hours a day. We also have our social media handles. We are on X, we are on Instagram, we are on Facebook. I think we are even on YouTube. So we normally put health messages there for people to see and then to like and share and then give us our comments. The other thing is that we've digitized you need feedback from people who use the service. We used to have these boxes, little boxes, where you drop notes in there. But I realized that in this day and age, you open it, there's nothing in there. People are more used to working on their tablets. So we've actually developed that. So we have these stickers, the QR codes. Immediately you scan, it takes you to our website, and then you can send messages to us. These messages are not seen by the public, but we have a back door where our IT department is. We've also strengthened our IT department. We have very good IT specialists who are also handling our IT issues here. So these are some of the things that we've done.
Any challenges in this process?
Okay, when we started, we had a series of engagements with the various professional groups in the hospital. We sold our vision to them and explained in detail why we needed to change course and the expected outcome. So we met with all the groups. We met with carpenters, we met with masons, we met with pharmacists, doctors separately because we knew that they had different challenges. So after engaging them that extensively, most of them came on board. So the early resistance that we felt slowly started to ebb away when they saw that the changes that we were bringing on board was actually good. So I wouldn't say we have major challenges. Aside of that, we still have issues of human resource. Yes, I think for me, if you ask me, that would be the major thing that we need. We need to ramp up the number of nurses, the number of doctors, the number of radiologists. Now when you go to the radiology department, at times they can't run night because they have very few personnel there. So that one, I'll say, is a challenge. And also we need to update our equipment base, especially when you go to the theater. On the walls and elsewhere, it's okay. But when you need to go to theater and operate, at times are operating lights, at times operating beds and those things. These are very expensive equipment. So we've already sent our proposals to headquarters to help us acquire these things. Once we're able to do that, I'm sure we'll be fine. And then the other problem is the new hospital that is there. We hope
the one just by us.
The one just by the gate when you enter. I know it's with 20 years plus.
20 years plus.
Yes. So once that is done, I think will be good to go. Because that one has a lot of theaters, consulting rooms. There's a lot of space there. So we are just hoping that it will be done. Once it's done, I think we'll be good to go.
This discussion has truly been enlightening, and we are gaining valuable insight into this transformation. We had the privilege to go for a tour in the hospital, and then we'll take a short break and then go have a look at how it looks like and what has become of it, and then we'll be right back. Stay tuned. Don't change that dial. I see this is the VVIP and POMAP.
Yes.
So it's not just the retired commissioners. We have other prominent people in the country that
Yes.
can also. Okay.
Yes. So this is what I was telling you about. So as you can see, we developed this into a very top-notch place to receive our guests, POMAP members, retired commissioners and IGPs, and then our VVIP people. So you can see some modern washroom, comfortable seats to sit on, and then we have a nurse and assistant all operating on the EMR. So everything is automated here. We have our scale and then we have our monitor. So when the vitals are taken from here, by the time you get to the doctor, everything is there.
Everything is in the system.
So
Wow.
it's a very comfortable place for.
I think I really like the ambience.
This is the children's ward. So you see, we've put 2 air conditioners here to make people feel comfortable. The waiting area, new chairs, new desks, one for doctors, one for nurses. All of their computers. So as you can see, there are no folders, no paper. Everything is on course, and it's all digital.
For children, when children are sick, especially with temperatures, cough and the rest, it's not advisable you take them to pharmacies or to buy over-the-counter medications. Doors are always opened. Don't manage them at home. Come and seek professional advice. We are always there.
So again, this is a mini lab. It is attached to the emergency. So as you can see, everything is software based. You pay everything, they take the samples, everything. So it's simplified. Yeah. So this is like the engine room. So you see our personnel handling the records of patients when they come through it. You are issued your card, printed here, and this is a gateway to the hospital. So as you can see, at first, all these places used to be filled.
Folders, yes.
So gradually it's going.
It's going.
So I'm sure in a couple of months it will all be gone.
Wow. And it's 24 hours.
24 hours.
Okay.
All right. But we also have this one. This on PVC, more durable, nicer, with the police logo and the hospital's logo. This is a logo for all the health facilities and personnel. So we have your name, date of birth, everything here. And with this card, you just go anywhere in the hospital. Once you are registered, just present this card. They key in your ID and everything comes on. So we are moving from this to this. This is the new police hospital card. Yeah, thank you.
So what about in case of emergencies where you don't have your card around? What happens when you come here?
When they key your name, it will come.
Wow.
Yes.
Okay.
And then at times you can even use your telephone number. So those are we encourage personnel to take snapshots on their phones so that, as you walk around, you may not have it with you, but your phone you always have. So in case of anything, you can just show them a snapshot of this, and that's okay.
I think we need to run a campaign where we say carry your card around.
Yes.
Just in case.
You never know.
Yeah.
So that's the best thing. But in case you are unable to, always have a copy of this on your phone. It's nice, isn't it?
It is. It is.
This is to welcome you. In the night, it lights up.
Okay.
So it's very nice when you come in. And we had these cabins there too.
Wow.
We like art.
Art.
So, yes. So we carved it into that place. So,
I see the emergency line.
Yes.
055-2333-222.
yes.
It's 24/7.
24/7.
Wow.
So this is what we call the U ward.
You what?
U ward. And U stands for unknown. Because of the nature of our work here, when there is a road traffic accident or somebody is knocked down or they see anybody who is not well, they bring them here. And when they bring them here, at times the kind of injuries that they have, we cannot mix them with the general populace of the clinic. Some of these people, we don't know them, and it's difficult to trace them, so they become the property of the hospital. We decided to build a dedicated ward for them. So there's a 6-bed that can be expanded to 10, and within 4 weeks, we'll complete it. We started it ourselves, and then a philanthropist saw it. So just last week, he has offered to complete it for us. So within 4 weeks, maximum 6 weeks, we'll open it. Yeah, so it's a U ward. Yes.
So this is our U ward.
And
Very comfortable.
as you can see, it's comfortable. We value our human resource, personnel who work here, and give cover to the hospital 24 hours a day, 7 days a week. So they must be comfortable coming. So we try to make the place comfortable for them with good furniture, television, AC, so that when they are working, they will feel good.
Okay, with the charge office here, we take entries of occurrences. Outgoing vehicle, any incoming vehicle, we take inventories of it. That's the most thing we do in the charge office.
So is there a possibility where you have people coming in to come in and report cases to you?
Yes, we do. We do sometimes get a complaint. Today, for instance, there was a little girl roaming around here looking for the parents. So one of the officers brought the little girl here, which I made entries to that. Later on, the parents came and then they came for the child. Yeah.
So this is the maternity ward. Okay, so again you see what we're talking about, computers everywhere. The doctors have their desks, the nurses have theirs. Nice ambience, work ongoing. This for superintendents and above.
Superintendents and above.
Yes. So, and one bed is always, civilians are always welcome. Okay, so that is it. 4 rooms for our executive patients. So civilians are also welcome. If I welcome them wholeheartedly to come and enjoy the excellent service that the staff gives.
Is this the only ward for senior officers, or there's another one?
There's another one, and that's the allied ward,
Allied ward.
where we have DSPs and ASPs, and at times chief inspectors. But that is also open to the public.
To the public.
Yes. Then we have the Heroes Ward.
Heroes ward.
Yeah, where we have police personnel who are injured in the line of duty. We have 2 special wards for them.
For them.
4 beds.
Anywhere in the country?
Anywhere in the country, once they are bringing them to police hospital, irrespective of your rank.
Okay.
You can be a constable or whatever. Once you are injured in the line of duty, you go to Heroes Ward.
Excellent.
So that way, afternoon, how are you? Are you the in charge?
We welcome you to female ward first.
There is a lab. ACP Gifty Rudolph. She is the one running affairs here.
Welcome to the police hospital lab. We have various units under the lab, so please let's enter here, which is the hematology lab. So this is our hematology lab where we do various tests on our blood samples, the full blood counts, we have the Widal section, others like glycosylated hemoglobin and others. This is our new blood bank. DSP Doris Hammond is our head of the blood bank. Over here, patients are assessed and then counseled before they are bled. And this is our donation area. This is where we bleed donors who come here. So our beds and everything. Screening room, where we screen blood of donors before they are bled. These are chemistry units, biochemistry units. Superintendent Lydia Otunyako is the head of this unit. So over here we test for kidney function test, liver function test, uric acid, lipid profile, and other tests. So these are biochemistry units where we have both parasitology and bacteriology working here. ASP Charles Wifa is the head of this unit.
So this is a refurbished theater. So the bodies are worked on here. The freezers are in the theater where we do the post-mortem assignment. So it was recently refurbished by the collaboration with the Interpol. So they gave us it.
As part of the transformative phases of the hospital, Medical Director touched on the fact that we have an oxygen plant. And behind me is the oxygen plant, and it is connected to all the wards. So we didn't have to carry oxygen cylinders to and fro the wards in case there is a shortage. So we have the biomedical team here, and they will be telling us much about it.
Welcome to our cryogenic therapy police hospital oxygen supply department. This is the tank that was brought to us to supply oxygen for the hospital. The initial fill was about 4.5 tons, and then we had to go through a system of purging. So what we actually had to deliver to our patients were about 2.5 tons of cryogenic oxygen. Cryogenic means liquid oxygen. So this is what the systems look like. We also have a dryer on it where we transform the liquid oxygen into gaseous state for the use in our wards. So this is a central point where we supply oxygen to the entire hospital.
Welcome back to You and Your Health. We have been having a good discussion with the Medical Director of the Police Hospital, Dr. Samuel Otunyako, Commissioner of Police. And we've been talking about the transformative changes that has taken place here. And if you just joined us, we are live on GH Police TV and all social media handles. So, let's continue. I know you have a very strong interest in HIV/AIDS. What targeted programs are currently running in the police hospital to address these issues?
Okay, maybe a bit of history. You know, back in the day when the HIV issues came up in this country, there was a big scare. All right, so people were afraid even to come to the health facility to seek help. Over the years, because of good work that my predecessor did, Dr. Siema, he's retired now. He's retired as a deputy commissioner. We came and then continued from where he had left off. So treatment for HIV now is a big part of what we do in this hospital. Okay. So we have the full gamut of services, from testing to viral load to all the various labs, and then medication. We have everything. So we treat police personnel and civilians that come. They don't have to go anywhere else to do anything. Okay. Once they come here, we do everything. It includes elimination of mother-to-child transmission, treatment, care and support, where we have the clinical psychologists coming as and when necessary. One thing that we've been able to achieve is not to use a test of HIV positive to deny policemen certain things and rights that is due them. You know, back in the day, to go on peacekeeping mission,
yes, you are denied.
Once you are HIV positive, that is it. I mean, you are denied. Yes, we write you off. But now we don't do that anymore. We put you on treatment. We make sure you are checking your viral loads and everything. So this is good news for personnel who may be HIV positive. Stay positive mentally. Take your medication. It will not prevent you from going on any peacekeeping mission. Because once you are okay, you are healthy. Sometimes we even give you medication for 1 year. Oh yes, we give you medication. You go. Once you are taking it, you are fine. So for the HIV, we are very high on the HIV mapping. Ghana, we work very closely with the Ghana AIDS Commission. Okay. We also work closely with the National AIDS Control Program. And then there's WAPCAS Plus, yes, UNAIDS. All of these organizations help us. They support us to do our various outreach programs, to talk to policemen. We talk about prevention, we talk about treatment, we talk about aftercare. So that's what we are doing in HIV. I must say that I'm no longer the head
I was just about asking that since you are now busy attending to leadership, I do not know who has taken your place, but I'm hoping that the person is equally doing.
Yes, so the person who has taken over the public health mantle in Ghana Police Service is Chief Superintendent Dr. Frank Dodu, who is also a public health specialist. So we have left the mantle for him. He's continuing from where we left, but we work in tandem. I always tell him that he's my head of department, so I work under him.
Wow. So public health is about prevention as much as cure. What community outreach has the police hospital put in place as a form of health education to the community around us? Yes.
So for us, the community around us will not be the civilians. It is the personnel, their dependents. So we do outreaches in the various police barracks here. We distribute BEC material, IEC material, information education and communication materials to them. We are constantly engaging them through the MAGAGS and police wives associations. Yes, so we have programs as and when we have the resources to reach them. Yes, and talk about prevention. We don't only talk about HIV. What we do is we talk about hypertension, diabetes, all these non-communicable diseases. Yes, you go with HIV, but then we try as much as possible to make it a complete health outreach. We even do treatment and care at times. Yes, so at times when we are going, we carry medication for the worming, malaria, things like that, that will make the outreach meaningful.
Staff capacity. How is the staff being equipped to move along with this transformation? I mean, in terms of training, recruitment, welfare, generally.
Yes, there's a lot of training for the staff. And it's not just training for medical care issues. At times, this year I think we've had 2 trainings for customer care.
Okay.
All right. So when a patient comes, how do you receive this patient? You know, those of us in healthcare, we are also human beings. We come from homes. So if we come from a home where maybe your spouse has angered you, your child has made you angry, do you come and visit that on the client who has come to seek care? So we realized that this was a challenge, and we started trainings. This year we had 2 of such trainings already to equip staff with the necessary competencies, so that when you come, you don't treat your patients anyhow. Our patients are our guests, and like I said, they are kings and queens, so we need to treat them well. Again, you know, twice a month we have clinical meetings, and these are meetings where we talk about clinical issues, and various doctors select topical topics for the hospital. So those who come actually enjoy these occasions when you have that close contact with our specialists. Every year, the medical director opens these clinical meetings with an overview of the past and what we hope to achieve this year. So this year I did the first presentation, and subsequently the other specialists are also doing this. So that's one thing that we do. Again, for the welfare of staff is very important for us. We meet periodically. This year we've met the civilians separately. Last Friday we met the personnel separately. In 2 weeks we'll bring the 2 together and we have a meeting. Yes, so that's how we do it here. Regular engagements with them, you know. I'll try to interpret in English. So if you are leading, you don't know whether the path that you are charting is straight or crooked. So no chance are exactly. So you need everybody to come on board. So at that meeting, we stress that people are free to express their opinions. Okay, so the opinions that they express, we take them very seriously. And then we try to shape that or incorporate those opinions when we have our core management meetings, or we are formulating policies. So there is frequent engagement. Aside of that, we also have one-on-one contact. Members of the core management are encouraged to be, you know, very, very good to the people that are working under us. Yes, interactive. Yes, that's the word. So if somebody is ill, we try as much as possible to visit the person. At times we make some donations. If somebody passes on, unfortunately, the hospital is there for that person, the relatives and everything. We try to engage so that the welfare of personnel moved forward.
Indeed, this is great leadership. I'm urging everyone out there, come visit us and come and experience quality healthcare, quality service delivery. So moving on to our next set of questions. These transformations that are happening at the main police hospital, how is that transcending to other parts of the regions? I know we have satellite clinics in all the regions. How is that transcending to them too?
Okay, so we have about 20 satellite clinics scattered all over the country. So this is the center. So if we are experiencing change or transformation, it must permeate and go everywhere. So what we are doing is first to visit them, and we do that a lot. You know, at times when you are at the periphery and you don't have people from the center visiting you, you feel like an orphan. So we've made it a point to go around, talk to them, see what is happening over there. The next thing that we've done is also to equip them. Okay, and to also ask the police hierarchy to help with some renovations. So Ho clinic has been renovated.
Wow.
It's an excellent facility. Now if you go there, you may not even recognize that is a whole clinic.
I know there's a new clinic at Accra region.
Yes, there's a new clinic at Accra region, another excellent facility.
Wow.
There's a new one at Kaswa.
Wow.
Yes, and there's a new one at Kwabenya, the workshop clinic. Is an excellent facility as well. And then when you go to Depot, you see that one too has been refurbished.
Yes,
in fact, they are also on the EMR. They don't use paper there.
Wow.
So we've tried as much as possible to equip them and also to make their workspaces look good. And when they come for their drugs and consumables, we always engage them. The thing is that they are there not on their own. They are working in tandem with us. And there could be transfers.
Yes.
They could come to the center, others will go and replace them. So it's not that we've left them where they are. We constantly engage them. During our clinical meetings, we also do the online version. Welfare meetings we have online, so that they participate, calling. So that is what we are doing for them.
What role has the police leadership and other stakeholders played in this transformation agenda?
Yes, without a tacit approval from police hierarchy, you cannot do anything. The way our system works, everything has to go through them. So they have been very supportive, supporting us with whatever we need. All right. So I can't mention all, but they've given us computers for the depot clinic. In fact, those computers we are using were given to us from headquarters.
Wow.
So when you go there to, like I said, the EMR is working, there's no paperwork there. Some of the equipment that we need, they've been very supportive in helping us to acquire those things. What we now need is personnel, the human resource. We are just hoping, but we've sent our request to them. Once we are able to recruit enough personnel, health personnel to help us, I think that would be the cherry on top of the pie. So they've been very, very supportive.
So you have mentioned so many transformations, so many changes, sustainability. What have you put in place to help sustain and maintain what has gone on so far? Good. So thank you for that question, and it's something that comes up a lot. People come up to me and ask. You see, we work as a team. Okay. My deputy director, Dr. Zakpa, and the rest of the core management team, and then the broader heads of departments. Every step we take, we share with them. Okay. We discuss with them. We go back and forth, so that everybody becomes a part of the decision. In some of these things, when you as a head, you take all the decisions on your own, then people associate those things with you. So that when you are not there, the next person that comes doesn't feel part of it and may want to now clear everything and start on his own. But when you do these things as a collective, we come together, we discuss issues, and then we move forward. So it is that we are in the same boat. So as in police, there's nothing constant. When I move, the next person, I'm 100% sure will continue and even take it to another level. What steps are being taken to ensure that the hospital is more accessible, affordable, and patient-centered for both the personnel and the general public? Yes, you see, unfortunately, everything costs money. Yes. So our services are the least expensive around us. Oh, wow. The hospitals, Trust Hospital, 37, and the rest, we are very affordable. Yes. And I think that is maybe the reason why we have 80% of our outpatient being civilians. Because, they also shop around and find out how services cost. So they come here a lot because our services are quite moderately priced. The other thing is that we accept the health insurance card. Yes, so anybody can come with the health insurance, and then we give them services. As we speak, the depot clinic will also start accepting health insurance very soon. We are in talks with HEFRA and then the NHIA to extend the health insurance acceptance to all our 20 clinics countrywide. So anybody, once we have your NHIA, you can just enter in and enjoy the spectacular service that we provide. As a researcher and a leader, what new areas are you looking to explore, develop within the hospital? I want to see more of private-public partnership. Okay. You see, as we speak, we don't have a CT scan.
in this hospital. We don't have an MRI in this hospital.
Okay.
But also remember that when there are road traffic accidents, this is the hospital that policemen, yes, they feel very confident bringing them here, because we cannot say we will not take such patients. So when you have just an X-ray, it doesn't give you the full gamut of investigations. Yes, so we need the CT scan, we need MRIs, and these are very expensive. So we may have to go into some PPP, of course, with approval from our bosses at the headquarters, so that we can have that service here. Once we have it here, most of the problems that we have at the emergency, where if somebody comes in with an injury that requires a CT scan or MRI, will have to be sent to other centers around us, will come down. Yes, so that is what I think we need most at this moment in time.
What is your long-term vision for the police hospital, and what role do you see it playing in Ghana's broader healthcare system?
So the police hospital in Accra should be a center of excellence. We want to surpass UGMC in the kind of services that we provide. When we say this, people always smile, so I'm not surprised you smiled. But we are in a good place to do that. Once we get the required resources and the equipment that we need, we will get there. We will get there. We are not moving in small steps. We are going in leaps and bounds. So once the environment is created for that, we will indeed become the go-to hospital in Greater Accra region. We will, that is our aim, and I know we'll get there.
Wow. Amen. Finally, what message do you have for the public about trusting in the new phase of the police hospital and taking advantage of the quality care rendered here?
So I want to talk to my people first, my community, that's the police, and then our dependents. You know, this is your hospital. This is your health facility. Contribute to making it an excellent place. Fact is, we all retire and go home. And once you're a policeman, anything they'll rush you here. Let's make sure that we have all the services that we need here, so that when we retire, we'll come and enjoy excellent service. Our men and women in uniform here are top-notch specialists. Nurses, doctors, lab scientists, you name them. We have all of them here. So we are ready to provide you the service that you need. So please, men and please, women and your dependents, we invite you to come to your own hospital. It is ours. Let's use it. Now to the community, our doors are open. Please come and enjoy the warmth of the police hospital. Here we'll not shout at you, we'll not say, go away. No, whatever it is, come. We'll accept you, and then we'll take good care of you. So everybody is welcome. We say and enjoy the great service.
Thank you very much, sir.
It's a pleasure.
Wow, this indeed is the new police hospital. The transformation at the police hospital is truly a testament of power, of vision, dedication, and information in healthcare. From state-of-the-art facilities to improved care and specialized services, it's clear that the hospital is not just evolving, but setting a new standard for medical excellence. To our esteemed guests, God bless you, Commissioner of Police, Dr. Samuel Otunyaku, for joining us today and giving us an overview of the transformation services and changes that are happening at the police hospital. And to our wonderful audience, remember, good health is a priority, and access to quality medical care can make all the difference. If you've been following this conversation, I hope it has given you confidence in the strides being made at the police hospital. This has been You and Your Health, and I am your host, ASP Kafui Ajimai. Don't forget, stay informed, stay healthy. Let your health be your priority. Thank you.